Your doctor is recommending an angiogram or coronary angiography. Why does your doctor want you to have an angiogram? Your heart is a muscle. Like all muscles, it needs a supply of nutrients and oxygen to function properly. Blood in the coronary arteries provides these nutrients and oxygen to your heart. Unfortunately, the walls of coronary arteries can become diseased and damaged. This can narrow the arteries, limiting blood flow to the cells of the heart. Narrow arteries can cause pain or angina. The narrowing can also become a blood clot, which blocks the artery. Blocked coronary arteries cause heart cell damage. This is a heart attack. Your doctor is concerned about your heart and coronary arteries. An angiogram will determine if your coronary arteries have damage, narrowing, or blockage. How is an angiogram done? During angiography, you will be awake but given a sedative to help you relax. Skin overlying a blood vessel in your leg, arm, or neck will be cleaned and then numbed with medicine. Through this area, a needle, wire, and then a small flexible tube called a catheter will be inserted into a blood vessel. The catheter is guided to your heart through the blood vessel. Special dye is injected through the catheter and into the coronary arteries. The dye shows up on X-ray, so the coronary arteries can be seen. As the dye flows through each artery, a special X-ray technique is used called fluoroscopy. Fluoroscopy is like a video rather than a picture. This can show damage, narrowing, or any blockage in the coronary arteries. Are there any risks with an angiogram? Passing anything through your skin and into a blood vessel carries a small risk of infection. It is unlikely, but the catheter could injure the blood vessel anywhere along its path. The dye could cause an allergic reaction, and though very rarely, it could cause damage to the kidneys. At the heart, the catheter can cause irregular heartbeats. These generally resolve, but a temporary pacemaker could be needed. Of course, any procedure involving the heart is risky, and even death could occur. However, over 1 million people in the United States have angiograms each year with very few complications. What precautions are taken during an angiogram? To avoid infection, sterile technique is used, and the doctor wears sterile gloves, a gown, and a mask. The risk of bleeding and blood vessel injury is reduced by the use of fluoroscopy and dye. These help your doctor safely guide catheter placement and reduces the risk of damage and irregular heartbeats. If you have a complication from the dye or the catheter, your doctor is prepared to immediately address the problem and treat it. While you're having the angiography, you'll be placed on a heart monitor, oxygen, and you'll have an IV. There is always a nurse with your doctor to monitor you while you're having the angiogram. Are there alternatives to an angiogram? Other studies like stress tests and echocardiograms provide a great deal of information about your heart's health, but they don't show details of your coronary arteries. An angiogram is the only test that provides pictures of these arteries. If you're worried about having an angiogram, talk with your doctor about possible alternatives. Do you consent to having an angiogram? While there are rare but serious risks with angiograms, your doctor believes that the importance of determining the health of your coronary arteries outweighs the risks. Now that you understand why an angiogram is done, how it will be done, and the possible risks and complications, your doctor needs your consent to proceed.